So that means wearing a mask, especially indoors, especially when you are in proximity to others. It means staying home when you are sick. It means maintaining distance from others. Working remotely, if at all possible. So many business sectors can actually achieve their work without being in office spaces together. Continue to practice good hygiene, and stay close to home. So the less that people move from county to county, state to state, community to community, the less likely we are to move the disease across our local community. So having talked about this engagement process and are looking at what are the drivers of transmission in our county, that is a very difficult thing to come by. We basically, and I've said last week, that we continue to see a lot of different things going on. And so we see disease spread in different communities. We're seeing more spread in some of the communities that were living at a very modest level of disease cases for a while. We're seeing uptick there. We think in Slow City, based on some of the feedback we're getting from our cases, some of it is from bars or other types of gatherings, even in restaurants with large groups. We are seeing across the board lots of people gathering in multiple family units or friend gatherings or large parties in some cases. We are definitely seeing a large number of at least one case, but in some cases many more than a single case in our congregate care facilities. So these are residential facilities of a variety of types. We've had some staff cases, again, in skilled nursing facilities or nursing homes, but we're also beginning to see it in a variety of types of facilities. So residential care facilities for the elderly, adult developmental disabled facilities, small group living situations, a wide range from very small congregate facilities, assisted living, to large, community facilities or congregate living sectors. We're seeing, again, in staff, but thankfully not inmates at this time, cases at our California Men's Colony. And we're also seeing from a lot of people that they have traveled. So that is, again, a good reminder. We still are under a state order that is variably complied with in terms of we should not be doing leisure travel at this time, and yet that is happening amongst quite a few individuals who are especially of concern going to places throughout the country that are experiencing much higher rates of disease. So not only are they putting themselves at risk by going to these so-called hotspots, but they're also bringing back to our community more disease. So I know that this pandemic continues to be very challenging in terms of how do we live our lives in a coexisting fashion with this virus, but one of the things that continues to be of concern and a vulnerability for us is travel both into the county and travel out of the county.